Hello to all of you. Thank you so much for joining us here on Parenting Playbook with Maureen Kyle on Fox 8 CLE+. Today's topic, there has been some new research that I think will affect a lot of families. So many people I know, I'm sure that you know, have kids or maybe even adults in the household that have been diagnosed with ADHD. In fact, according to the CDC, 7 million children ages 3 to 17 are diagnosed with ADHD. 6 in 10 are what considered moderate to severe symptoms. Now, new research found that there are possibly 3 different subtypes of ADHD, which can have a big impact on how it's diagnosed, how it's treated. This is new research, but I was curious, is this super groundbreaking? How is this going to affect families who have kids who are diagnosed ADHD? How do we move forward knowing this new information? So my guest today is Dr. Hallie Fetterman with the Cleveland Clinic. Thank you so much for joining me today.
Thank you.
So this is just within the last couple of weeks, I saw a few articles on these 3 different subtypes. What do you think about this research?
So this research in my opinion, confirmed a lot of what we have been doing currently in our diagnostic and treatment procedures for ADHD. However, it approaches it with a purely kind of approach to use brain scans to get to those 3 subtypes. So the article itself uses a lot of complex statistics to get to that point. But what you can really use as a researcher or a clinician is that out of 1,000 kids and 1,000 brains with ADHD that they looked at, they did not use what we typically use to diagnose right now. They kind of used a blank slate to categorize them. And from that, they came up with roughly similar subtypes as to what we're using now. And so just as you mentioned, we have our kind of combined or severe combined type, which we do know when there's more symptoms across inattention and hyperactivity and impulsivity that leads to more difficult outcomes. But we also see predominantly hyperactive impulsive type and then the inattentive type too.
Yeah. I'm no expert. I'm just a parent who has a lot of friends who have kids that have these symptoms. And I just want to kind of hone in on what the subtypes were. Because to me, I'm thinking, when I saw the subtypes, I'm thinking, oh, yeah, well, that's my daughter's friend, or that's this kid that I help coach. Just to reiterate, it was severe with emotional dysregulation, predominantly hyperactive, impulsive, and inattentive. Does that, when you see those subcategories, was that super groundbreaking? Did that surprise you that the research found that there were these 3 separate kind of subcategories?
Great question. So I wasn't necessarily surprised that it was separated into these categories. ADHD has been around for like decades and decades. How we've described it or named it has been different. But you can see back in medical textbooks, from a century ago where they're discussing similar symptoms. And so we know, we've known for a long time that there are brain differences, and that's what makes it a neurodevelopmental disability, is its differences in the structure and function of parts of the brain. But what this study did was hone in on, 4 specific presentations. Are there different neurotransmitters that are implicated that could help people pinpoint medication use a little bit more correctly? So with the different subtypes, the thing that excited me the most was seeing emotional dysregulation in one of them, because notably and really importantly, that is missing from our diagnostic criteria currently. So if you sat down and you were being seen for an ADHD evaluation, we would ask you about the 9 symptoms of hyperactivity and impulsivity and the 9 symptoms of inattention, but nowhere in there does it ask about emotional dysregulation. But researchers in the field for a long time have been describing that as a core feature of ADHD. And in my parenting groups, I often describe it as like emotional impulsivity. So a lot of kids with ADHD, not all, but again, a good portion of them will feel their feelings very intensely. So Often that gets people in trouble when it's anger or frustration. It's a very salient emotion, and that can cause kids to either have difficulty with friendships or lose friendships or have difficulty learning new skills because their frustration tolerance is more limited. But with an ADHD emotions, the triggers for being upset or dysregulated is similar. You can understand why it would happen. I always give this example. If you stubbed your toe, you wouldn't say, "Oh, that's great." You get upset about it, but they kind of go 0 to 60 much faster, and they stay upset a little longer. But it makes sense as to why they may be feeling that way. So that's when we say emotions are very intense, and so I do believe a lot of people in the field believe that emotional regulation will be included, or a lot of people are advocating it for it to be included in future diagnostic manual criteria. And I think this will or could and should be used to support that too. So that, again, is, I think, the most exciting, at least from my perspective, of what they found.
I want to ask you a little bit more about that. That's fascinating to me because we all have kids who, or we've seen kids who do have bigger reactions. As a parent, as a caregiver, as maybe a teacher or a coach, is there an age? Because I'm thinking like 3-year-olds, if they fly off the handle because they did stub their toe or whatever it may be, or a shared toy or something, I feel like that's age appropriate. But when does it stop being age appropriate and we start to really look at that emotional dysregulation as something that could be ADHD?
Yes, that's a hard question to answer because there's no like right or wrong way to answer it. And again, I often say you can think of ADHD symptoms as like a spectrum or a scale. Everyone struggles with inattention at some point. Everyone is, disorganized at some point. But when it becomes, or when you should have kind of red flags for ADHD, we see kids having that difficulty much more frequently and much more intensely. So again, not a hard and fast benchmark, but for preschoolers, if they're having, multiple tantrums that last more than 15 minutes, that we could consider that like atypical or something to follow up on. And then when you think about ADHD in particular, you're also thinking that it's not just at school, just at home, or just at like baseball, but it's something you see at in multiple environments. And then another thing to consider is that it's causing difficulty in their day-to-day life. Because again, you might have trouble or difficulty managing emotions. But I always say like young kids are very forgiving in their interpersonal relationships. So we don't always see like difficulties with friendships at that point. But once they start to get more nuanced, or the social interactions are more challenging, or school starts to get harder, then we see, they're struggling to keep up, or it's impacting their mental health or self-esteem. And that's when, again, you can have all the symptoms and not an impairment in your daily life. And we wouldn't call that a disability. It's just, perhaps there are things to learn or strategies to use. But if you're using those strategies, or you're applying things and it's causing a lot of difficulty in your day-to-day life, then it's trending more toward a mental health diagnosis.
Yeah, that's so interesting. All right, so we have the 3 subtypes, and you mentioned the 9 questions that I think a lot of parents have gone through that, where you've been asked, or if we've just Googled it to be like, I don't know, does my kid have it? And you look at the 9 questions that are asked. But with these subcategories, and you mentioned there's a spectrum, but is there any overlap? Like, do we have a inattentive and hyperactive? Or are these subcategories, you have an inattentive, you have a hyperactive, or a severe?
Yes. So that's the other, I think, not necessarily a limitation, but something to continue to learn more about in like this field, or particularly with this study, because actually our diagnostic manual calls ADHD not subtypes, but presentations. And that's because the presentation can change over time. So who you are as like a 6-year-old, typically that diagnosis is like the loud, rambunctious, disruptions, interruptions, very externalizing behaviors. Then again, a typical trend would be once school gets to be more difficult, kids tend to be they have a presentation of combined type, where there are a good number of both inattention and hyperactive impulsive symptoms. And then most adults and teens meet criteria for simply inattention. So as your brain develops, you have more of an ability to inhibit like those outward, you're not necessarily standing on desks and interrupting really loudly. Those symptoms of hyperactivity tend to turn inward. So adults describe that as like feelings of internal restlessness, or your foot is like bouncing a lot. So it's not that they go away, and often also talk to families about you don't really grow out of your symptoms, but you can grow into your symptoms. So we do expect there to be some change over time, and there is overlap, at least what they saw in the study as well. Notably, though, the more severe presentation with the emotional dysregulation that had the poorest and most significant outcomes, which means that they struggled and they had higher rates of co-occurring like anxiety or depression, mood concerns, which makes sense when you have trouble regulating your feelings. And so I think it's really notable, like at least especially for that class of kids, where if you're noticing that early on in a brain scan, you could potentially find the right fit for medication faster. But that is a great point. There was overlap in the study, and there's certainly overlap in like real life too, because a kid at school is much different from a kid who, again, is like playing a basketball game. And it's really hard for either teachers or parents or even kids themselves to understand is that ADHD symptoms are variable, not only in people, but across settings too, because your environment demands different things at different times. So it's consistently inconsistent is the best way to describe.
Yeah. You mentioned brain changes. So I'm going to throw a couple questions out at you because I don't know. I just think this is fascinating how. So some of these symptoms you mentioned, can change as the brain changes. Let me ask you this one, and I'm sorry, I know this is new research. Do they know if it's coming from different parts of the brain, these subtypes, or is it all just one part of our brain? Like, is the hyperactivity coming from a different part of our brain than the inattentiveness, or is it all the same part?
I wouldn't say that they were able to pinpoint it like that specifically quite yet. But what is difficult with these neurodevelopmental disorders, so I will loop in like autism, for example, too. We know that and we've known for a long time that there are differences in brains, and again, the way the brains develop. But there are so many different presentations of ADHD or so many different presentations of autism that it really is complex and different. So there are certain things like dopamine is one I think that we hear a lot, even in social media, like chasing the dopamine and feeling like you need to get some more. But also there are parts of like the prefrontal cortex and parts of your brain that do like measure smaller in some ADHD brains, but we're not quite there yet. But it's explained by the fact that it's a spectrum as well, and so hopefully in the future, as research continues, that's something they can identify.
Yeah, I mean, I'm thinking we talk so much about how kids' brains are still developing, and so as a parent, I'm thinking, okay, well this will change as they grow older. We are going to take a quick break, but when we come back with Dr. Hallie Fetterman, Hallie, I want to ask you about treatment and how we help our kids go through these symptoms too, especially as we've honed in on different subtypes. So stick with us. We'll be right back. Welcome back to Parenting Playbook. Today we are talking about ADHD, but more specifically, just in the last few weeks, you may have seen articles come out saying that new research has found that there are 3 different very specific subtypes of ADHD. And this is something that might not surprise you if you have a child that struggles with ADHD symptoms. It might be something that is going to change the way we treat it, the way we recognize it. Our guest today and expert is Dr. Hallie Fetterman with the Cleveland Clinic, and you have been just shining a light on so much research and information when it comes to ADHD. I do want to talk about treatment because that seems to be the main concern for a parent when they finally get that diagnosis for their child is how are we going to move forward with this? Before we get into that, do you think this new research finding these subtypes will change the way ADHD is treated in any way?
I think it has a potential to make some movement in the future. So this was, I think, a kind of an initial or first start, and there would have to be a lot of validation studies, and really it doesn't necessarily prove that. It just proves that there are different subtypes. It doesn't prove that that is beneficial for treatment quite yet. But you know, like I've said, we've known that there are differences in brains of ADHD, and if there are certain presentations, particularly kids with high rates of emotional dysregulation, it could be helpful to look at their brain in the future and be able to pinpoint and potentially find that right medication fit a little bit faster than what some families typically experience.
I know a lot of parents, when they do get that first diagnosis, just even within my own friend circle, their child gets the diagnosis, and there's a lot of hesitation to immediately jump to medication. I had some friends try therapy, counseling, before they went to a medication. What are your thoughts on that? If you can speak to parents who do have a child who has been diagnosed, maybe, in the future they find out the child's diagnosed. What are your thoughts on medication versus therapies? And I know we talked about there's a spectrum, and I don't know if that plays into it.
Mm-hmm. Yeah. So there is a lot of research on both medication and therapy for ADHD. And I always talk to families about like a treatment plan for ADHD is multi-pronged or multifactored. So there's no one size fits all or one treatment that's going to like quote unquote fix anything. But one of those prongs is education or learning about the others. And so when it comes to therapy or what we typically think of with psychology, you will see a lot of the time therapy advertised for ADHD, but what we know is that therapy can be helpful for adults with ADHD. So their brain is formed, fully formed, or almost fully formed, and they can think in a sophisticated way about their thinking. So we use things like cognitive behavioral therapy, which has a behavioral component in that type of therapy. But you might work with a therapist to develop, your own phrase of don't put it down, put it away, and hopefully that will change your behavior. Now think of like a 7-year-old who's highly impulsive and does not have a fully, formed brain yet, telling themselves don't put it down, put it away. They are not going to do that, and that's typical brain development. So what we know is that actually, very applied, hands-on, giving a lot of practice, redirection, feedback, practicing the correct thing is going to be much more helpful for young kids with ADHD. And so that's often targeted through behavioral parent training or, skill groups where kids are practicing in simulated or potentially real environment and getting in the moment performance feedback. And so this all comes into play because medication can complement that very well. So, as a psychologist, we are teaching the skills and the strategies, how to do deep breathing when you're upset or walk away or, those type of, organize your binder. But there are some kids who are so inattentive or so impulsive that even if I taught them until I turned blue in the face, they just aren't able to pause quite long enough to be able to practice and use that skill and become fluent in it. So yeah, sometimes families do defer medication to try psychosocial treatment first in these skill groups. But for a lot of kids, it's not always enough. And that's also because, it's by definition an impairment. It's difficulty in your day-to-day life. So if kids are feeling, we don't want them to feel like they just can't do it or not enough. And that's a big sign that medication could be a consideration because it's really their brain working against them. And it doesn't mean that you need to use medication for the rest of your life either. Stimulant medication actually is has one of the highest, positive response rates. So around 70 to 80% of people will respond to the first stimulant medication tried, which is why it has become such a first line treatment for a lot of people. And and again, if you experience a negative or bad side effect, you can stop pretty quickly. And so in that case, I will tell families a lot of the time that some I've heard from families that sometimes they wish they would have done it sooner because the stakes are pretty low. You don't like it, you stop, but you won't know, and you'll sit and ruminate on that decision until you try. And everyone wants the best for their child, and for a lot of them, adding it helps them get further a little bit faster.
Yeah, absolutely. We're headed into the summer months, and every parent, no matter what their child is like, every parent struggles with the lack of structure that all of a sudden happens because kids are out of school, the routines are different, life is different, and every parent promises they're going to keep their kid from going through brain drain, et cetera. What does it look like for a child and a family with ADHD? Like, what advice do you have for parents who are on that verge of summer and the routine is going to change? How does that affect somebody who is diagnosed ADHD?
hmm Yeah, I think a lot of families struggle with the idea of giving kids a break, and then, but also wanting to have some of that structure in there too. And I think you can do both. I will often say that kids with ADHD actually need more structure or more kind of rules or boundaries to help them adhere to that and learn a habit or learn a routine. So it's never a bad thing to have that structure, but you can build in anchors into your day, like one 5-minute chore, one reading worksheet, and then one something else where you still have some loose structure, but are able to give them very clear and specific things to follow too, because we see a lot of kids with ADHD, or a lot of families wanting to avoid that summer slide. And so for parents or caregivers, my recommendation would be to only give a checklist or activities that you are able and willing to follow through on. So it goes both ways, that whatever you give to your child, you should follow through on as well. So finding a nice middle or routine where you both can relax a little bit because it is summer, but still give them some structure is helpful.
I've heard from a lot of families and a lot of experts over the years when we do talk about ADHD that sports is actually a great outlet for kids who do struggle with all of these subtypes of ADHD. What are your thoughts on that, especially since sport camps and things are opening up over the summer?
Yes. So yeah, I've heard from patients and families that both ways, that individual or team sports are, better for their child. So it definitely depends on the person. Team sports can be frustrating for some kids because there's a lot of waiting or, teamwork, winning and losing. So I think probably a slight majority prefer things like taekwondo, karate, gymnastics, because it is individual, or swimming, an individual sport. But either way, we use sports activities in a lot of our treatment programming too, because it does give kids structure. There's rules. You work on sportsmanship and positive peer interactions. So finding, I think, the right fit in terms of a coach or flexibility, because families also talk about, it can be hard for kids during practice or games. So I think families have had the most success when they've found a coach who can provide that type of structure, but also be understanding that, their child is not going to be perfect. No kid is, but they may need a little more redirecting, but are happy to be there.
Right. I think any adult who's coaching has either coached for years and has had kids who have been under all of these subtypes. So yeah, I think that's just part of life. I want to go back to the subtypes, but now focusing on adults before we wrap up, just because over the past few years, I've known so many adults who have gone, and gotten diagnosed and had this light bulb go off, like, oh my gosh, this is what I've been struggling with. But you mentioned that brains change. Do you think that there's any of these subtypes that adults will struggle with more? Like which ones will adults realize that they have been struggling with for years? Would it be the emotional dysregulation or the hyperactive, impulsive, or inattentive?
It would likely be inattentive is going to be the larger majority. I think someone who experienced hyperactivity or impulsivity in life may have had more intense challenges. So they may have been, asked to leave the school or team because of some externalizing or big behaviors. But what flies under the radar a lot is the inattention. And when we say inattention, it's a not a great descriptor. And actually, the term ADHD, attention deficit, is not a great descriptor because there's a lot more than just inattention that goes into it. But you'll see adults who are disorganized or have a lot of hobbies that they start but then never finish, poor with money, difficult time like staying engaged in a job or like kind of job hop because they're always wanting to find something new or exciting, or on to the next thing. So managing their time if they're always late or running right on time. Those are things that, like, little instances again here and there are typical, but sometimes you can look back and say, this has been like a chronic difficulty across jobs or across things. That's more indicative of this is more probably a pattern and a difficulty due to your brain.
Yeah. Well, I love that there's more research going into it because I think that this is just it's making people realize that this is what they've been struggling with. There's a diagnosis. There's something happening in the brain, and now we're getting the right research and we're getting the right labels put on there. Dr. Hallie Fetterman, thank you so much for joining us today. This has been wonderful.
Thank you so much for having me.
And thanks to all of you for watching Parenting Playbook. We have more episodes always streaming on Fox 8 CLE Plus, and we will see you right back here next week.